Okay. Your next page is fentanyl. I don't want you to do a whole lot with this page. The reason why I put this in here is for you to make sure you know, again, there is no PO fentanyl. You can look on there, you can see lollipops, you can see the transdermals, transmucosal, lollipop is one of those, the parenteral, the transdermal. How often do we have to change that patch? 72 hours, 3 days. Yep. Every 3 days or 72 hours. Every 3 days or 72 hours. So one of you guys became a nurse. It's been a while now, but one of y'all became a nurse. And you were actually an LPN. You were at work. I guess you was thinking about this lecture, but you remember me telling you that when you're doing these transdermal patches, in the chart, it's going to say you took the other one off. And then you put this one on. And that's, if you falsify that information, that is a fraud. That is a felony. That, especially if the patient's on Medicare, because it's a federal insurance, it becomes a felony. Fraud is a felony. So she was outraged. She went to go put the patch on, but before she did, she went to get the old patch off. This patient had a ton of patches, just like they be having with it's another one that they do that with, the patient, Aricept patches. Patient be having a bunch of Aricept patches, which is your Alzheimer's drug, all over their fucking body. She had to write a SIRS up, because you remember, that's an overdose. You still have residual from that fentanyl. So please, y'all, check the whole body. And this is what you guys, if you work as aides or already LPN, you're going to see that. You're going to see that more often than not. Have you seen it? Yes. What is wrong with people? Are they just lazy?
And then they said they wasted with somebody, because you know you got to sign off saying you wasted with somebody because it's a narcotic.
It's a narcotic. Damn. Just lying. So that's a good point. You're supposed to waste it with somebody.
So you lying about that too.
You're lying about that. I can't. Yeah. Trifling, y'all. Trifling. Okay, so y'all got it. Turn the page. Insane in the membrane, as they say. Now, your next page should have the malignant hyperthermia on it that we were speaking about. Malignant hyperthermia. What I want you to see that I wrote already, and you just need to really highlight it, is I wrote some notes and kind of underlined some things, and you just need to highlight it. One of the signs that people may miss, and this goes back to what I've taught you, that if the patient has tachycardia and the rate is above 110, you should lose your mind, because you know that's going to be some garbage. So, well, I guess I should start at the top just to give you two things that isn't underlined. But do you see where it says the sudden unexpected death? That's at the top, first 3 lines. I mean, first 3 words. Y'all see that? Yeah. Highlight that. The fact that it's unexpected and all of a sudden is what makes this so depressing. Because you're trying to catch it. You're watching everything. If you look on the right-hand side, it says, oh, I lied. If you go to the second paragraph after the first one where you highlighted the sudden unexpected death, you see it says MH crisis. On the second line, it's going to say the actual drug that caused it. Do you see succinylcholine? Second line, second paragraph. Y'all see it? Paralyzing agent, succinylcholine. Yes, no, maybe. Yeah. Okay, so here's the deal. I teach you guys to remember it like this. The patient died from sucking on some choline. I want you to remember that. Sucking on choline, succinylcholine. They died from sucking on. So I had I had Lindsay. She's still at the Cleveland Clinic working in ICU, PRN. No, she became a nurse practitioner. What am I saying? I helped her. She became a nurse practitioner. Now she's working in cancer. But she came in this class. She had failed 3 times, and she was sitting in the seat. And she listening to me just like y'all listening to me. She gets her brand new job, all excited, working in ICU. This particular day, she's precepting with the male nurse, who's really nice. And the nurse manager comes around because apparently somebody had just died a few days earlier from malignant hyperthermia. So the nurse manager is going around the unit to different nurses asking them, what's the name of the medication that usually causes malignant hyperthermia? So she gets to Lindsay and her preceptor, and she's not addressing Lindsay. She's a new nurse. She's precepting. She's addressing the nurse precepting her. And it's this guy. And it's kind of typical. We do shit like this as nurses because you'd be like, whatever. So the nurse manager is asking him now, what is it that you think is the most common drug that causes malignant hyperthermia? I don't fucking know. Just being real. You know, that's how we are in real life. He's laughing. He's like, I don't fucking know. Then he's kidding around. He's like, psh, ask her. Lindsay knows all her drugs. She goes, okay. What is the most common drug that causes malignant? And she was like, oh my God, I know this. It's called sucking on choline. Sucking choline? The nurse manager was dying. She's like, well, it's close enough. Succinylcholine. So the guy looked at her and said, how'd you know that? Because our teacher told us that's like really important to know about this general anesthesia, killing you instantly, almost like within a half an hour, you're dead. And she taught us to remember it by saying the patient was sucking on choline. You guys will be surprised at what you remember through this whole crazy ass class. So please highlight that. Make sure you know sucking on choline. Then you see it says increased heart rate, and then it says fever. Now look, pay attention to that fever. That's crazy as hell. What's the temp? 110. Damn. I ain't never seen that in real life. I hope I never do. Because usually a fever, 102, 103, 104. We're talking 110. That's insane. You're pretty hot. Okay, that's insane. Now, when you look at this, look what I wrote. I wrote that's a late sign. So even though in the name, malignant hyperthermia, it's in the name. Hyperthermia means fever. It's still a late sign, and if you wait on that, you waited too late. Okay, it's a late sign. Now, the word malignant means deadly. You know that, okay? If you go down where it says drugs that trigger MH, you can see the succinylcholine. You can see a few other things, but the key, and I do want you to highlight it, is general anesthesia inhaled. General anesthesia inhaled. Okay, now turn the page. Under how is MH treated, next to that question, I want you to write IV dantrolene. IV dantrolene. I want you to make sure you know this is a muscle relaxer. IV dantrolene, and this is a muscle relaxer. At the end of the very first paragraph where it says preparedness is essential to prevent death, I want you to write cooling blanket, IV fluid bolus, IVF, IV fluid, IVF, IV fluid bolus. And you need to decrease the potassium. So part of the treatment. Okay. Part of the treatment is to decrease the potassium because this patient has a high potassium. If you go down, let's see. If you go down to where it says, how can MH susceptible patients be identified? I wrote the answer. Do you see it? Mm-hmm. Highlight it. Muscle biopsy. That's the diagnosis. Underneath, how can MH susceptible patients be identified? Underneath the actual sentence, you're going to write that question I told you about again. You're going to write, has anyone in your family ever died in surgery or immediately after? So far, so good? Mm-hmm. Okay, turn the page. Now, the last page we have on this issue, it says, can MH occur outside of the operating room? You're going to put yes, PACU. What does PACU stand for? Yep, post-anesthesia care unit. Very good. Post-anesthesia care unit. Recovery room, we used to call it. PACU. The majority will happen in the OR, but there are a few people that give you enough time to figure it out, and they do it in the PACU within that first hour. So one of the things, and this is so important, please remember this. The most important vital sign immediately post-op is actually the temperature. Because then we say hyperthermia. Remember that temp gets up to 110. What are patients going to usually feel like coming out of surgery? Hot or cold?
Cold.
Freezing. So to have a patient come out of surgery and have any fever is crazy, because you know they didn't have a fever when they went in because we told you that was a reason to cancel the surgery. Now you bring them out and you're looking at 106. That was your red flag right there. So that's why I get mad when I get report and that person didn't even take a temp. No time during the whole thing did they take the temp. That's insanity to me. Like, you don't even get what the patient could die from. Okay? Okay, so now it says, is MH always hereditary? Make sure you know, yes, it's autosomal dominant. Autosomal dominant. Yes, it is always genetic. Only one parent has to have the trait. Autosomal dominant. Okay, you're done with that. Next page. Next page says OR patient. You got the OR patient. This is very easy. Just a couple things I want to point out. It says on the left-hand side with the guy holding up his hands, it says sterile field, right? I want you to look at, or I want you to highlight the bubble that says open packs away from the field. Just circle that, or highlight the circle, I should say. Do not reach over the sterile field. Under sterile procedures, I really want you to highlight every one of those. I know you know surgery. I don't know if you know biopsies. I'm thinking you definitely know catheterizations, injections and infusions, but do you know dressing changes? These are all sterile procedures. Next to injections, next to that word, I want you to write insulin injections at the house. Insulin injections at the house are not sterile. Do you see where it says sterile procedures and it has a key at the top on the left?
You got it?
And it has all those different categories, and next to the word injections, just put insulin injections at the house is not sterile. You see the word catheterizations? Catheterizations in the house are not sterile.